All right, everyone. This is our 13th Health Talk, and this is on blockchain and security token offerings. And we're just going to run down a high-level overview of blockchain technology in general, how it's applied to healthcare and what we're doing. Also start going into the security token offering that we're going to have and just the general trend of that happening in the marketplace. So I'm going to start off by letting James kind of take it from here and give really just a high-level overview of how this technology is working. And James, for everybody that doesn't know, he is our blockchain architect. He is pretty in depth with the crypto economic structure of everything going on. And James, if you want to give just a brief intro to your background too, that might help everybody. You muted.
There we go. Hi guys. So yeah, as Brendan says, James Cunningham. I'm based over in the UK, and I'm doing blockchain architecture stuff for Citizen Health, the kind of crypto economic network design for that. Day job wise, I work over here as a researcher at the University of Manchester, where I do stuff in the field of health economics. So what I'm going to kind of start by talking about is blockchain, what it is, what we can do with it, what it means. It's always a bit of a problem giving these kind of talks because either you end up patronizing people by giving simplistic analogies about stuff they already know, or you end up blinding people with science and begin talking about complex stuff that just confuses matters even more. So I'll try and pitch it somewhere in the middle, but apologies in advance if it's either end of that spectrum for you. Just as a kind of heads up for people, or if people give me a heads up here, who would consider themselves knowledgeable about blockchain technology, what it is, what it does? Wave, show of hands, if a little bit. Okay, cool. Right, yeah. So that's, I mean, I'd be surprised at this point if people hadn't at least heard of it in passing, either blockchain or Bitcoin, which is the currency and originally associated with blockchain technology and the kind of source of the development of that technology. So Bitcoin is a digital currency. It's money that exists only in digital form and is exchangeable through protocols online. There are other currencies now that are associated with the same technology, things like Ethereum, Litecoin, Ripple. And beyond that, there are also tokens, which you may have heard of. These are kind of quasi-currencies that partly money that you can exchange, partly something that has some specific utility in some specific field. And then going beyond that, blockchain is used more and more in different applications, different areas. Obviously, we're coming at it from a health perspective. You're also seeing its adoption in the insurance industry, in various sciences, in the economic sphere. So blockchain, what is it? There's many answers to this question. One of them, obviously, is that it's something that allows digital currencies to work. But if we take a step back, one way of looking at it is that it's a solution to a problem. It's the answer to a question, and the question is, how can we agree? How can we agree on things? Obviously, that's quite a broad question, a bit of a meaningless question. So it's in a more specific context of that originally. How can we agree on financial matters? How can we agree that I have $10 and Brendan doesn't, for example, that I have X amount of money, Megan has Y amount of money? So there's two ways of doing this. One way is to have money represented by something physical. If I'm holding a $10 bill in my hand, then I've got $10. There's no physical. The answer to that question is a matter of fact, and it doesn't. As long as we're broadly agreeing on what money is, then if it's a physical entity, then it's just a matter of fact as to how much I have, whether it's paper money, whether it's shiny metal, whether it's seashells, leaves, wood, whatever it is. If we agree that money is something physical, then it's a matter of fact as to what it is. But that's not practical. I mean, we're moving more and more towards a cashless society, I mean, people still carry money around with them. But it's very rare nowadays that someone's entire wealth would be in the form of physical money, either held on their person, at their property, even in a bank. So the majority of money and the majority of money supply in the world is virtual, in a sense. It's something that's written down. The bank doesn't physically hold your bank balance in a vault, where what it is that written down somewhere in the bank, you have a record of how much is in your account. When it's spent, the bank records how much of your money leaves your account. And if it goes to a person who's in the same bank, they increase the number next to their name, so to speak. So that's the question that blockchain technology and Bitcoin was trying to answer. How can we agree on how much money, how much value, how much currency different people own? So from what I've said, that's kind of already answered the question. What we do is we trust somebody to record that quantity for us, and as long as everyone agrees on who to trust, then we have a working monetary system. If the banking system reliably records that I have X amount of dollars, Brennan has Y, and then when I transfer some money to him, those accounts, one goes up, one goes down, then we've got a working system. But the people, or the anonymous people behind the invention of Bitcoin, had another problem, and that is they didn't trust banks. They didn't trust the government. And in fact, they're coming from a perspective where they didn't trust anybody. So now suddenly the question becomes a bit harder, which is how can we agree on how much money different people have, different people own, given that we have zero trust in anybody. You can ask the question why they're doing this, and the answer partly comes from politics, political views, partly comes from the world environment in 2008, 2009, when this was invented. We're coming off the back of the last financial crisis, and looks like we're entering another one. So yeah, the zero trust. How do we do that? How do we all agree on something? How do we all agree on values? How do we all agree that everybody has a certain amount of money when we don't trust anybody else? Now, there's no obvious answer to this question, which is why the invention of Bitcoin, the invention of blockchain technology, was a very significant thing. Now, sometimes when you're trying to tackle technical problems, trying to find the solution to technical things, the best thing to do is imagine that you have a magical solution. Imagine you can just do magic, and then we'll come up with a solution that works on magic, and then we'll try and unwind that and see if we can actually make it work. So now, if we want to agree on everything and we can do it by magic, what can we do? Okay, we'll have a magic notebook. Yep. We can write things down in. Now, because it's magic and I can do what we want with it, there's going to be as many copies as this as I want, and I'll give one to everybody. Everyone can have one of these magic notebooks. And what makes it magic is that if I write something down in it, what I've written down in it appears in everybody else's notebook at the same time. And just so if someone else writes down something on the magic notebook, it gets shared with everyone. Right. Now, if we now want to decide who owns what, we'll start writing things down. If I want to give Brennan some money, I'll write down in our magic notebook, I transfer $10 of my wealth to Brennan. And then if Brennan wants to give that money to Megan, he can write down the same thing. We would, if we had that, we'd have a shared record of who had given what to who else. And then if we started from the beginning of the notebook, went through it page by page, jotted up who'd given what, who transferred what to anyone else, we'd come up with a series of totals which represented people's bank balances, so to speak. There's one thing missing from that, which would be what's to stop us faking signatures. Why can't, in our magic notebook, why can't I write down that I am Brennan and I transfer $10 of my wealth to Megan? Well, so we'll also have the fact, we'll imagine a world where I can sign entries in this notebook, and we'll just imagine that I've got a unique signature. No one can forge it. It's unforgeable. And so if I sign something next to a note that I've written in this notebook that everyone else gets, then people will know it's come from me. So if we had that, and we all agreed who started with what money, then we'd have a system whereby we could work out who had what wealth and we could share it amongst ourselves. And that's what blockchain is. It's a digital way of doing that. It's a digital way of sharing these notebooks or ledgers, because they're to do with money, between various parties in such a way that everybody gets the same copy of what anyone else has written in it. There's a way of signing messages in it so that only I can sign messages that come from me in some sense. And the only thing we're allowed to write down in this notebook is values of transactions that go from one person to another. And effectively, via fairly complex mathematical cryptography, that's what blockchain allows us to do in a digital form. And that's what the underlying technology of Bitcoin was. It was the invention of this blockchain, this consensus mechanism for sharing information about wealth and about wealth transfer. So that's it from the beginning. I've probably either patronized you or confused you. Hopefully there's something useful out of that. But yeah, so that's where we've come from. That's what Bitcoin was. It was a means of representing values of wealth that can be recorded universally. It can be distributed amongst users of this system, and it can be done so in a secure way, and it can be done so in a clever way, such that everybody gets the same information and can be assured in some sense that if I see something that's been written down on this blockchain that's been recorded, then everyone else who shares my view of the world sees the same thing. That's the cleverness of it. The genius of it was working out how to do this without using magic. And there we are. And then obviously once you've got this in for one currency, it's very easy to transport this to other currencies. They do it in different ways. They have slightly different mechanisms of sharing that data. They have slightly different philosophies behind what the supply of that money is, who can use it. But we get a bunch of digital currencies coming out of that technology. And then as it moves forwards, we can do more and more clever things. It's not just information about money that you can write down on these blocks in this notebook. It's data, general data about other things. It's rules as to how different things can interact with each other. But underlying it all is this idea of the blockchain, this shared view of the world. Yeah, Brennan, I don't know if you want to jump in at this point and guide us as to where we're going next for this talk, but if anyone wants to jump in with any questions, criticisms, fruit throwing at this point, welcome to.
I like hearing different descriptions and viewpoints of what a blockchain is, because it seems like wherever you're coming from, you have a different explanation. It's so large, and it's really an idea if you kind of get down to it. And one thing that I like to kind of conceptualize is the idea of a shared database for an industry. Just for instance, one of the last times I was on an airplane, okay, let me walk through this. So I purchased Wi-Fi on one flight, and then I was getting to my connecting flight, and I was wondering if I could transfer that over there. There was some situation where, oh yeah, that's what it was. I purchased Wi-Fi, it didn't work. So I was wondering if I could transfer it over to my next flight, and I get up there, and it's the same airline, and the lady said, "I'm sorry, sir, we don't have that record." And I was like, "Well, why not?" She said, "Well, our system doesn't talk to that system." It's like, well, it's part of the same airline. Like, where's the problem here? And for instance, having a shared industry-wide database, the problem would be solved. That's the problem, is you have one database over here, one database over here, and it does not talk back and forth to each other. So stuff like that, will be solved by this technology.
Sounds just like healthcare.
Oh yeah,
just like interoperability.
Oh yeah, and we're at the very early stages of blockchain technology, and even the term blockchain, it's in 5 to 10 years, you're just not even going to say that. It's just going to be a giving. That is what's the technology used. And even the structure of blockchains, it's like literally you append blocks to another block and it forms a chain. Well, you're looking at hash graphs and tangles and all kind of other different consensus mechanisms. And different protocols. So in the future, who knows what it's going to be? But the idea is people can trust each other without having to know each other. And there's a lot of use cases. And you've probably seen these ICOs that have been just launching for just about every single industry over the past 2 years. 99% of them are going to fail. That's the nature pretty much with every startup. The majority of them are going to fail. A lot of them just were terrible business models or never even had a business model. They just launched ICOs. But this technology will completely disrupt industries. A lot of these industries that rely heavily on middlemen, healthcare, insurance, they will be eliminated. Just they won't be needed anymore. And we've done this through the progression of humanity. I mean, the people who made carriages and stuff, once the vehicle came out, they were no longer needed. And these progressions will be happening with all the technological advances that we have. It's just a given. So I'm really interested about what we can do in healthcare, because that's kind of why we're all here. There's a huge need for interoperability, for everybody to talk back and forth with each other, for ownership to be given back to the patient, and to take all the hands out of the cookie jar that don't need to be in there. And this technology will allow us to do that. Now, as far as we're looking at some questions here, there's 4 questions on the article. We're using blockchain in a lot of stuff that we're doing with Citizen Health. For one, everybody knows of our MEDIT token. That's the unit of value that's generated from our health score. If you do healthy things, walking, sleeping, stuff like that, you generate a MEDIT, and that's an ERC20 token. And now I think I want to get to the point where we're talking about security tokens and non-fungible tokens, because this is, in my opinion, the non-fungible tokens are a game changer, even more so than the fungible tokens were. And what I mean by fungible and non-fungible, fungible is, for instance, if I had a $100 bill, I could exchange it with you, James, or with you, John, and it's still a $100 bill. It's still going to buy the same thing. Likewise with Bitcoin, 10 Bitcoin, same thing as 10 Bitcoin. But with non-fungible tokens, you can take a unique asset and tokenize that and have that represented digitally. And it's unique, like a Pokemon card or a baseball card or a work of art. These things can be tokenized and ownership can be assigned to them. And for instance, what we're doing with these health service tokens is taking a surgery, let's say a complete knee surgery, and that is a unique asset because it is performed by one particular surgeon at a particular surgery center at a given time for this price under these terms and conditions. So that is unique in its own right. So we can tokenize that and have that representative of that service. So that's one aspect on how we're using this, but getting into the security tokens, that's something that is, I can't even begin to estimate how big that's going to be, because if you just look at derivatives in general and securities in general and how well they're traded every single day across the world, well, take that back, not every single day. On the weekends, these, of course, the exchanges do not operate, which is one huge benefit of security tokens. But the idea here is to take a security, such as a equity or a debt security, and tokenize that. Instead of think about a traditional common stock in a company. You have a stock certificate. It doesn't do much, right? But now you can have a security that is programmable, that you can assign certain rights to it, that is easily tradable. You can have instant settlement time. You can have compliance baked into this, so you know which entity holds this particular security and what they can do with it, the limitations on it. So it's going to open up the doors for new market dynamics to form with the securities markets. And if you look in general, if you log into TD Ameritrade and you have some shares of Apple and Google in there, you don't actually own that. You don't own that at all. You have a right to trade that, but not the clearinghouse, but the actual company, they own these shares. They're just displaying them in your account. Well, now you can actually own the shares or the tokens and trade peer-to-peer if you do want to. So there's new things that are coming online, and that's what we're doing with with our MEDIX token. That is a security token. So we are taking common stock in Citizen Health, and we're tokenizing that. So we have a MEDIX token, which allows you to do certain things, and we are currently in the middle of programming those certain things and coming up with exactly what this token is going to look like. We've been talking about it for some time, getting the architecture right, and we're to the point now where we're going to release it shortly. We do know that as a MEDIX token holder, as an equity holder in Citizen Health, this token will allow you to receive dividends from all the transactions that happen on Metaplex. So we'll be taking a small percentage fee, like Visa does, credit cards, for all the transactions that happen on Metaplex. And a percentage of that fee will be dispersed in proportion to all the token holders out there. So that's the concept, because we want people to have skin in the game with Citizen Health. We want everybody to own Citizen Health and to profit from the success of Citizen Health. So that's kind of our structure with what we have with the utility token and security token. So if anybody has any questions, feel free to step in and ask away. No?
So I'll ask a question. So let's say you have an orthopedic surgeon who is part of your network and does a surgery, but he is going to have to interact with the real world to put the lights on and to pay the nurses. How does he go from the virtual currency to paying his nurses and keeping the lights on?
Good question. And that is the big problem, or the big question for cryptocurrencies in general is, okay, well, you have a currency. Are they really being used as currencies? Up until now, there's not too many cryptocurrencies used as currencies. But with our MEDIT token, that will be used to purchase health and wellness products and services, but it'll also be used to pay physicians. So this orthopedic surgeon, he will get paid depending on how much he's willing to accept. We're starting off at a 90-10 ratio. So 90% USD, 10% MEDIT. So they'll receive that. And as a physician, you can use that MEDIT to purchase supplies from our marketplace, from Metaplex. So the idea here is to bring on vendors that have supplies and things that surgery centers, clinics might need, and they can use that MEDIT to purchase that. And we can just create a new economy for healthcare supplies and services. That's the idea. Secondary, the physician can take that MEDIT and convert that into MEDIX. So they can convert that into our security token and do two things with that. Either they can stake it, and James, you can get into this a little bit longer, but we can stake it on their node in the network and earn more dividends from all the transactions. Or they can turn around and resell it on a trading platform such as Open Finance. And I'm going to share a link with you. Open Finance is a new security token trading platform. I can't say exchange. What was that, Megan? I can't say exchange. Yeah, so it's a trading platform. I keep confusing those two. Now, New York Stock Exchange, the owners behind that, they already announced a initiative called BACT, and this is for institutional investors to come on board and start trading these security tokens and just tokenized securities in general. So the idea here is to take these security tokens and turn around and resell them just like you would with a share of Apple. So the idea is, okay, well, I need some money to pay my nurses. I need some money to pay my mortgage. You just put it up on Open Finance, and a buyer buys that, and you get the fiat currency, whatever currency you're looking for. So the idea here is we're going to automate this, where you can say, okay, well, let's just go with 50% of my earnings every month. I want to convert that. I want to put that up for sale and receive fiat payment for that. So that's kind of what we're looking at, is either you can just stake it and keep it and hold on and let the appreciation build and let the dividends build, or you can just turn around and cash out and sell it.
But yeah, so as Brendan says, the idea is to kind of bootstrap our own internal economy here. So if you know, our long-term aim, so to speak, would be to have a internally consistent economy where you could be paid in Medit, and you could use that Medit to purchase other services that you'd use. And once you've got that going, less and less you need to kind of step outside that system. But we're never going to get to a stage where you can buy food, where you can pay your mortgage in Medit. So there always needs to be a kind of out for the system. There always needs to be a way of exchanging it out.
I don't know about that.
Well, okay, it depends if we're talking medium or long term here. But
okay, go ahead.
No, go on.
I was just about to start just talking some crazy stuff, talking about student loans. If you look at the loans for medical school, and that's a big problem because a lot of physicians, they rack up $250,000 in debt, in student debt. Well, you're kind of pushed in one direction to take those high-paying specialty jobs so you can pay off your debt, which in reality, you might not want to do that. You might just want to be a family practitioner and focus on that, but the pay is not there. So it's warping the dynamics in the physician specialty side, I believe. So now if you look at what if we do offer a way where physicians can get their student loans paid for if they're working in this Citizen Health network. So, and they can pay their student loans back with Medit. And we actually, the student loans comes from our peer-to-peer funds that, I mean, of course, this is long-term. Once we do have a significant amount of money, of currency in this, they can actually take loans from the community and pay the community back in Medit. So this is just part of it, that jump starting of the economy. This is, of course, once again, it's probably 5 years down the road.
But yeah, so exactly, we aim to get to that point, but we realise that we can't get to that point by saying, come along, join the Citizen Health economy, we'll pay you in this magical cryptocurrency that we've invented. Come along and do it. That's not going to work. So this idea of gradually kind of ramping up the amount that you'd receive in that, and then having a kind of practical use for it, not in terms of being able to use it in a marketplace before that started, but in terms of being effectively able to stake or temporarily exchange the Medit you're receiving for services into Medix, which will receive dividend payments from the Citizen Health as a whole, will be exchangeable, as Brendan says, as effectively equity holding, a shareholding, that you'd be able to cash out. This is our kind of means of bootstrapping the whole thing. And as we move forward, as more and more people come on board, then less and less you'll need to externalize that Medit in order to get value from it. You'll be able to use it internally within the system, and we'll grow out from there, so to speak.
So there was a panel at the Seattle GeekWire Summit last week, and it was a blockchain panel. And one of the questions was, how do you know blockchain is right for your industry? And these experts basically agreed that there are two principal things. One is you need an industry where there's a large amount of data. But the other thing is you need a large enough network. And if you have those two together, you can sustain an ecosystem. And the example where this came up is someone represented the NFL at this conference. And they say, well, that's perfect because you have lots of data about these players and you have an existing large network. So am I right in saying that the key for Citizen Health is to reach a critical mass of physicians and patients? That's kind of the key milestone to make this a viable technology. Is it a critical mass of people and physicians interacting? Is that the key thing right now?
Absolutely, yeah. It's A, getting to that critical mass, but B, it's designing the system such that the critical mass that we need to reach in order to make it work is as low as possible. So, I mean, you could design a lot of the kind of healthcare related projects out there suffer from the problem that they would be brilliant, but in order for them to be brilliant and in order for them to work, they're going to need a huge amount of people to start using it from the get-go. We're very opposite of that problem. So, for example, if we're just starting by selling imaging or reselling imaging services or representing them on the blockchain, then the critical mass you need to reach there is smaller if we can get it so that effectively what we're using our cryptocurrency for is not buying and selling everything, but essentially is a discounting mechanism on already existing services within already existing networks. Then the critical mass for it actually being useful and actually being used lowers itself again. So it is those that's very kind of, I like those 2 points. I think that's those, obviously people knew what they were talking about. The network is important, but what we're trying to do is ultimately is to replace the existing networks, usurp them and make them much more efficient, but do that by kind of riding on top of bootstrapping ourselves into existing networks as much as possible, and to design what we're doing with very much bearing in mind that we need to lower that the necessary critical mass as low as possible so that we can actually get into the system. It's very easy to design mechanisms that would work perfectly if some benevolent dictator ordered everyone to start using cryptocurrency all at once, then it would work. But that's never going to work. You're going to have to fight the system from the inside to replace things gradually. So that's kind of the general philosophy, I think, an approach that we're coming from.
Yeah, I think we are, like you said, James, the idea is to create an environment where the networks grow faster. There's network effects. That's what it comes down to. Crypto economics is aligning incentives and creating these positive feedback loops that enable network effects to happen. And with what we're doing, if you look at each physician being a node, so to speak, in our network, well, let's just say each physician has a patient panel of 500 patients. Well, this is starting to scale quickly because you bring on 10 physicians, look how many patients you have. Bring on 100 physicians, look how many patients you have. Those patients can start working with their employers, bringing their employers on board. Then you have employees that come and go from this employer. So you're starting to see how this network can grow fairly quickly, especially if it's sticky. Using Humantive, using this app that's motivating people to be healthier and gamifying the pursuit of health and tying all these different incentive mechanisms in place to grow this out and to start creating value for all the participants involved. I mean, it's a step-by-step process, but I do think we're on the right track and we're laying the infrastructure at the early days to get it right, to have a stable platform to grow on. And it's going to be interesting to see how it plays out, because I know in 2019 we'll be starting these pilots and these physicians will be rolling out Humantive and everything else we have to their patient panels and offering our solution, especially with Humantive, in their bundled offerings to employers. So it's like I said, it's going to be interesting to see how it plays out, and the network effects. That alone, we've talked about this health operating system, but if you start looking at all the hacks that happen in healthcare, now I shared that one website one time. It was like 60 hacks already, but this year, and this was like in summer, we're talking about half of all patients have had their patient data leaked, stolen somewhere. And now creating this new type of distributed or decentralized storage network where almost like a federated blockchain, if you will, having these physicians potentially, or having these physicians actually secure the network, secure the data. This is one thing we talked about. I'm kind of getting into patient data now, but let me get everybody's feedback on this. Patients don't necessarily want to own all of their health data on their phones. They just want complete access to it, and they want complete control over it and access to it whenever they need it. So the idea here is to create this decentralized storage network of the physicians that are those nodes in the network, where you are storing the patient data on there, fully encrypted, that the patient has access and they can delegate access to it. That is something that we've kind of discussed about a little bit, but we're about to get to that point where that development is happening. So let's just toss around that idea for a little bit. We got a few minutes here.
Well, one thing I ran across in kind of preparing for this meeting was the concept of a public-private key and how that would work with electronic health records. And so you can have a public data set out there that's encrypted, but the patient come in with a private key, like their fingerprint, into any doctor's office and puts it down, and that unencrypts it. Because at some point, the doctor needs to know that that's the patient that he's seeing. And I thought that would be a much more useful way, is, you know, the electronic health records are out there but encrypted, but when you have the patient there, the electronic health records becomes available. And I ran across this on an article called like Fire Chain or something. It was a PubMed article on it that looked pretty interesting. So that was one thing I said that's very useful, because one of the biggest problems is getting a hold of the patient's information who's not part of your network, which in an urgent care setting was about 30% of the patients that I saw. So
I wonder if we can just calculate up all the time that's wasted filling out form after form and just have, if you did have a shared database of the health records, and you could just go to a new clinic for the first time and just say, here's my health records. I don't need to fill out this form anymore. You have complete access of everything. So, sorry, James, go ahead.
Yeah, and one way of looking at what you're actually doing is carrying around your public key and unencrypting records when you go to a source. But effectively, what you're doing is carrying your records around with you, because you have to be present. You have to be there to unlock it. So it's as if you had your own personal copy of your medical records that you could go and plonk on someone's desk when you go and see a new physician or whatever. A way of doing that, but it's a way of doing it much more securely. I mean, there are difficulties and hurdles to overcome there. What if it's only me that owns the key to my data? What if I lose it? What happens if I'm not physically capable of giving you that key when my data is needed? You know, if I'm unconscious, somebody needs my medical records more urgently probably than if I'm not. So there needs to be other ways of unlocking it. You bump up against legal requirements. If there's a disease outbreak or something, maybe medical records need to be made public. You don't need the patient to unlock them. You need to verify that patient doesn't have a disease in a certain area. So it's a very nice way of doing it, but it's slightly more complex than just having a kind of public key and a private key. There needs to be multiple ways of unlocking it. There need to be fallback mechanisms. Because with public key cryptography, there are ways of doing it where it's literally unbreakable. Those records are encrypted, and without the key to unlock it, you never can. So that does begin to introduce problems. So what happens if you lose the key? What if someone else needs to unlock it? But that general principle that data can be everywhere, but only people with the key can unlock it, therefore it's both kind of public and private at the same time, is a very powerful idea, and something that will gain immediate traction when you begin to translate that into kind of the practical outcomes of it, that you can have medical records transported anywhere, without the need for interoperating systems, without the need for physical transportation, without the need to request records via fax or phone. And that touches on something Brennan was saying about kind of non-fungible tokens. In a sense, you can have your health record as a token on a blockchain, or the keys to it, the references to that data, and you can transfer that around. And then that gives you ins for lots of other things. You can have payment mechanisms on top of that. You can have traces of who's accessed your data for what purpose. You can offer your data for research. You can donate your data in a sense. You can donate only to research projects that you're interested in. You know, I want to effectively give the keys to my data, not all of it, just the non-personal records. I just want information that I've got about my diabetes treatment. It's not real, but I want that data to be donated to diabetes research, because that's something that's affecting my family. Here are the keys to the diabetes portion of my medical record, and I'm donating them to a research organization. And then I can go back a few years later and I can say, what was my data used for? Oh, look, my data was part of the study that cracked this cure, that created this new drug. You know, it's once you start thinking about data in this way, about it being transferable, about it being, you can break it in parts, give it to different people, it becomes a very powerful concept, and it unlocks, it's not just kind of personalized medical personal health records, and the side of that, even if you want to start looking about kind of selling data to corporations, to pharmaceutical companies for money. You can start doing that. So it opens up such a unique world of what you can do with that data that's not been there before. And there's huge potential for disruption there.
Oh yeah, that's still, James, when you hit on that idea a few weeks or a couple months ago now, the idea to tokenize your data into a non-fungible token based on episodes of care, certain treatments. This can be in a non-fungible token, and I've been kind of racking that idea around, and I still think that's the answer to this. There's a lot of people talking about patient data. Patients need ownership of their data. Great. Okay, that's a great tagline or a great mission. But what does that actually mean? Give them ownership. What are they going to do with that then? How do they give that to researchers and receive compensation for that? How do they track that? So using what James was mentioning right there, I still feel that's probably the best way to go about doing it. And I'm excited to go down that path and to flesh that out and see how it fully looks, because I don't think the technology is there yet, but every day it just gets quicker and quicker. So especially, people say that this is where the internet was in 1993, 1994. Well, yeah, but the thing is, it's going to grow so much faster than the internet did in that time frame. So just seeing what we have now and the path that we're on and the infrastructure that we're laying, I'm excited to see how this plays out in 2019. Heck, for the next 3 months.
I think one of my issues of blockchain initially in healthcare, because it's obviously the last year and a half it's exploded, right? I would think last year's HIMSS, there's only like 2 papers on it, and then this year's HIMSS, everyone was talking about it. One of the things I thought was interesting, and just coming from the HIE world, right? I've helped implement quite a few large HIEs out there in the US, overseas as well, and then getting into that with the interoperability side is, in essence, to me, blockchain is basically a federated model, right? You have multiple not central repositories, there's no central repository. You have multiple repositories where it's all filled up. HIEs in a federated model constantly crash because of just the volume. When you try to query one over there, or if they all have that same storage, you're now having, if we start getting, scaling this out, you're now having like petabytes of information that everyone has. Are you going to do it in certain sections? You start running into performance, problems or query issues. That was always one of my hesitations initially on blockchain. So I don't know how you guys have factored that into it as you scale and other things like that, because in essence, in HIEs, no one's really storing like DICOMs or anything else like that. It's HL7, CSV, whatever else it is. You run into that issue of just scale and performance, and is that being addressed here? So
one of the things is you kind of need to perceive it differently. So when you're talking about kind of public-private key encryption, stuff like that, what you're doing is you're carrying around the key to unlock data, and you're giving permission for that key to be used. So that doesn't necessarily mean that all of the data itself needs to be distributed everywhere. You can still have the data siloed, so to speak, or held by data providers in certain hospitals. But what you do is you distribute the permission for other people to access that data. So it's not that every single bit of data has to be held at every single node in the network at every single hospital. But if I've had MRI or PET scans, that's terabytes of data for me personally. That doesn't need to be distributed everywhere, because you just get an exponential explosion of data that can't be addressed. But if that's held in one place, but what is distributed is my permissions for other people to access that, and then I grant a research organisation, another hospital, the permission to access that data, and then they can take that permission to the source of the scan data and then access it themselves, pull it out, and I can be assured that that's done securely via the mechanisms, the kind of cryptographic mechanisms that blockchain provides. Then that's a very nice solution for it, because you're absolutely right. You can't take all the medical data out and distribute it to everyone. So it's more that you're taking the keys, for applications, rather than distributing the data everywhere so that everyone has access to it at any point in time. So I think that's one way of addressing it. Another mistake that is often made by people who are applying blockchain to healthcare is that they say, oh yeah, blockchain healthcare, the obvious thing to do is to put data on the blockchain. And that doesn't work, because as you say, if you take that, if you scale that out to its logical conclusion, what you do is end up every node in the network needs to have a Amazon scale storage center in order to store everything. It doesn't work. So you do need to do that. And I think there are solutions to that. And it's not to take that kind of slightly crude approach of just distributing everything everywhere. It's to realize that some data needs to stay where it is for practical reasons because of the volume of that data, for legal reasons because it's not allowed to leave the source, it's sensitive, but to carry around permissions, to kind of tokenize the permission, tokenize the way in which the data is accessed, and being able to distribute that, hand that to other people in order to use.
Right. So like in your case, just so I understand it better, you were in Manchester, I believe you said. So in the case of, let's say you ended up at Oxford for some reason. So let's say all of your PT and everything else is stored on the Manchester side. There's a query that can come in from Manchester into that store and pull your information for some reason. Let's say you're stuck there or something to that effect.
Yeah, it's almost if you could attach the token giving my permission for that data to be accessed to the query. And it could be carried there, and they could say, right, we've got a query for some data, and look, here, we've got this signed message saying that James gives permission for this data to be transferred. We can use the blockchain to check the permissions of that. Yes, it works, so we'll transfer that data over. And that kind of, it kind of flips the problem of sharing and distributing data on its head. It's not that you necessarily have a system where all the data is distributed, but you have a system where all the data is distributable. And there is a subtle difference there, and that's something that we're very aware of.
Sure, and and I won't name the HIEs on here because it's on YouTube and everything else, but there's some HIEs where they've done that federated model where it's the same type of thing and this is where I was talking about the query, where hopefully, I guess with the token or smart contract in the situation where you send it out, it knows that the majority of information is stored at the Manchester location, because when you send that query out to, let's say, all the other NHS facilities or something else to that effect, that query is what slows down everything in that process. And trying to search for James Cunningham and with whatever information of your ID, searching for all that in the different stores is what slows down the performance of retrieving what should be seconds, may take minutes or hours. And that's what's crashed some of the HIEs that I've been involved with. That was where my hesitation happened in that. So if it's that permission and that query system works and it can scale with that large store, that's perfect. But that was always my hesitation in some of the blockchain applications in healthcare.
Yeah, absolutely agree with that. And you can be clever as to working out before running that huge query what you're looking for. If that token's not storing my data, but it is storing where bits of my data are, then that can be passed to everywhere where my data may be, but they only need to work out which bits they're retrieving, and you get a much more efficient system. So that kind of clever ways of, it's distribution. The kind of distribution doesn't need to be binary. It's not either distributed or not. You can distribute different things. You can tokenize different things, and you can send not just the query. I don't carry, in the same way that I don't carry the data with me, I carry the key to that data. So my query doesn't carry all the data with it. It just carries the query that's necessary.
Sure. And I think that's just where my point was going, is just obviously, talking with Megan and Brennan and Nabil and everyone else, I obviously want to see this succeed and be something amazing. It's just, I'm always hesitant because of the experiences I've seen in that world. So making sure, as you're saying, those clever ways of making sure it's considered when getting to that type of thing, because you don't want that to happen, because I unfortunately know too many HIEs are down constantly because of the models that they set up. When they try to query a system, the entire thing crashes because they didn't do that query in a clever way or consider that when they start scaling to tens of millions of a patient population.
Yeah. Is there currently a marketplace? So right now I can go to my doctor and I can ask for my electronic health records. I can, legally, it might take a week, and I can obviously go online and get some stuff right away, but I can get all my information. Is there currently a marketplace for a patient to sell their information? Just today, does that exist right now, as far as you know? So,
no.
And so there's certainly not a marketplace where I could sell my electronic health record information and sell my 23andMe information. So that marketplace doesn't exist.
Unless you go on the dark web.
Well,
it runs about $450 or so right now.
In terms of a product, and I'm sure most of these companies are kind of on the down low. They have a lot of this information and they're trying to put it together in the background. But I'm just curious if that marketplace currently exists.
Well, it might be worth saying no, it doesn't exist for you, but it probably does exist for the companies that hold your data.
Correct.
just because you can't sell it doesn't mean it's not being sold with everyone else's, and that's another thing that gives. That's one of the kind of promises of this kind of personal health record, is that you're in control, not just of the transportation and use of that data, but of the sale of that data. And that's where we're going to run up against problems, because inevitably people are going to realize that by giving patients control of their data, it's being removed from them, and there's going to be a commercial hit from that. Because these marketplaces don't exist for you, but they do exist for the companies that are holding your data.
I will add to that. There's no marketplace like I think you're imagining, and there's no marketplace that should exist like we're thinking. But I do know a Savvy Co-op, they do, I'm not going to say that they sell your data. Well, in a way they do. Certain surveys and certain things based on your condition as a patient, and they're matching up researchers with patients. So in a sense, that's the start of a type of marketplace. But I think what you're imagining, no, it does not exist. And that is something that we will definitely pursue if nobody else does that. Now, here's where I'm at. This is the question I have unanswered, James, and I'm going to ask you this. Okay, let's just say as a patient, all of us right now, we just say we have the same genetic variants for this particular type of cancer, and we want to pull all of our data together and sell it to a research company that's offering us $1 million for our data. Okay, well, that's great to that point, but what happens next? What type of data does that research company get? And what can they do with that data? Can they take that data and resell it to somebody else? Like the actual format of that, what does that look like?
Well, so again, going back to this idea that what you're not selling the data, what you're selling is permission to access the data. And you're not just selling permission to access the data, you're doing that in a contractually sound way. So yeah, there's always this analog gap problem. You can never encrypt data once it's unencrypted, because I could copy it off the screen, I could take photographs of it. Once data is available to my system, it can be copied. But if you've got a very strict and legally binding sale of the permissions of this data, I am selling you permission to access this data for this sole purpose, for this amount of time and for this amount of money. And it's wrapped up in a contract such that if it turns out that you do resell it, you're actually kind of breaking the law, you're open to being sued or whatever, then that's a very strong thing. So I think that's another area that kind of crypto economics blockchain needs to advance in, is actually producing a legally sound basis for smart contracts. So, if I can sell you a contract to access my data for a specific purpose, and by breaking that contract, by doing something else with the data, you'd be doing something that opens you up to legal recompense, then brilliant, that's what I'm doing. So I'm not selling you a bunch of data, I'm selling you the permission to access my data for a particular purpose at a particular time. And I think that's where we need to be coming from. And then that again bumps up against this idea that we're not distributing all the data. What we're doing is distributing permissions. We're selling permissions for data. And I think those two things go hand in hand.
So for clarification on that, then, in my case, when you get the key to unencrypt that information, you have access to it, are you able to select, kind of going into Brennan's case, specific information, or once unencrypted, all information's unencrypted? Because going back to the EMR side of things, right? Typically when you access certain information, like in an HIE, let's go back to that world again, since that's my world. When you pull up a patient's information, certain information, depending on state regulations, will be blocked. certain medications that they take, mental health and other things, because if it's a primary care doctor or someone else, not all that information is displayed. You actually have to quote unquote break the glass to access that information and give her reasons why. So is certain information protected, or once unencrypted for whatever purpose, all information or all that is unencrypted?
Yeah, so I mean, it's almost, look at it, if I could not give you a key to access my data, what if I give you, what effectively what I'm selling is a query. I'm selling you a query over a database for you to retrieve that data, and that's been signed by me, and the system that holds my data has an obligation only to execute that query and return that data. That suddenly gives me much finer grained control over what can be returned. I'm not saying, here's the key to all my information, please be careful with it. What I'm saying is, here's a key that unlocks, select star from diabetes information and return that. And that gives you that kind of breakdown in control, that kind of, what you're doing is you're kind of contractualizing queries over data. You're not just handing keys around. And that's what we're aiming for in terms of capturing on the blockchain, having these kind of non-fungible permissions that you can apply to data and allow people to get it. As I say, once data is unencrypted, it's unencrypted, and there can always be a bad actor within the system that takes that and runs off with it. So it may be that we go down a path of having kind of multiple layers of encryption, multiple kind of strata of encryption that encrypt different things in different ways, and that's the kind of power of smart contracts. Is that it gives us much finer grained control over key access, and that also then goes some way to solving that key management problem, in that it can't be the simplistic case where I have the private key to my data and no one else does, and then if I lose it, it's gone. There has to be a kind of much richer model of how data is encrypted, how it's unencrypted, who has permission to access it under what circumstances. And I think the kind of that smart contract element of it comes into play there.
And then one other additional clarification just off of Brennan's saying, so let's say collectively a group says like, oh, we want to sell you all of our whatever genetic information from 23andMe or whatever the case may be. You said you're not really selling them the information, you're selling them permission to access that, right? Or that's what we're collectively giving them. Is that then, I mean, how is that information downloadable? Like as in you can get a CSV file of all the information because they're going to want to run whatever information off of that, or it's only present on the chain and they can only view it from the chain. How are they accessing or being able to compile their analytics?
In this model, they would effectively be requesting a dump of that data, but they'd have requested it in such a way that they'd done it through a mechanism that legally bound them to using it for a certain period of time, or not having it leave their systems, making sure it was destroyed, deleted or something. And that's why it's very important in this space that we begin to get solutions or answers to the problem of how we make smart contracts tie with the jurisdictional, the kind of legal environment which they're run. Because it's all very well having this kind of philosophical code is law kind of thing, but once you leave the blockchain, that doesn't apply. So if you could have a smart contract that allowed me to access data, but that smart contract also bound me into an actual real legal contract that I had to protect that data, I had to use it for a certain purpose and destroy it after a certain amount of time, then we begin to get answers to those questions. But yeah, the kind of what we've been envisaging is that it at the end of the day, once it's unencrypted, you're just getting a dump of that data, for example, and it will probably depend very much on the system that you're accessing. But the only thing you can do in those cases is to bind people within the legal environment to using it correctly. You can't try and keep everything on chain because it falls down for a myriad of reasons.
Now, I'm imagining this with the idea of Metaplex. With our marketplace here, we have essentially the patients and the healthcare providers. Now you can have the patients and the data buyers or the researchers. And you can have patients segment their health data into, okay, this is my genetic data. This is my biome data. This is my activity data. This is my episode of care from my whole cancer episode. And you kind of go on that list and you can tokenize things that you want to tokenize. And based on the different variants and just your makeup, you can be, I guess, pooled with other patients, with other people. And then you could say, all right, I'm willing to offer this for sale. And everybody can come reaching a consensus saying we're all willing to offer this for sale for $1 million. And I almost have like a bid and ask system where you can put put up an ask for your data, and then researchers come there and be like, you know what, that's exactly what we need. Yeah, we'll pay that. And have this marketplace transact like that. And also you can have the researchers go there and put their criteria out, exactly what they're looking for. And we have all the patient's data over here. We can match them up. So it's like that. And keep going back to the eHarmony for the patient and physician relationship. This could be the eHarmony for the patient and researcher relationship as well.
One comment on that, just as a physician, and I think there's real potential with that, is I found, after seeing a huge number of patients, that patient privacy, partly because of HIPAA laws, is huge things to the physicians. But I generally find that in reality, patient privacy is not very important to patients. It is if the doctor breaks it, and he'll get, in huge trouble, $10,000 fines. But I find that patients share their data all the time.
Yeah.
They're very open about it. And so for them to monetize that privacy, I think there would be a rush. There would be like a gold rush to do that. If patients thought they could make an extra $200 a month releasing their electronic health records, there would be a line down the street for people to do that. I mean, that's just my sense.
Yeah, and from the flip side of that, from coming at it from kind of the research perspective, from the other side of the aisle, so to speak, I think you're absolutely right. I think it's not privacy that patients particularly care about. That obviously it's important. It's honesty. I think they care if they think that you're taking their data behind their back and selling it or giving it to someone. That's what they care about. So if they know what's being done with their data, they've got a much more nuanced view of the privacy aspects. It's my data. It never needs to leave, my hands, so to speak. I think they're always willing to share it. The patient data in particular is meaningless if it's not shared. It can't be private. It needs to be shared with the doctor. That's the point of it. So I think what is needed from a patient perspective is openness and honesty as to what the data is being used for. And they need to be the ones giving permission. If they feel that it's being taken behind their back and their privacy is being broken that way, that's what they care about. The fact that someone sees it and the fact that they might be able to sell it, as you say, they'd probably be open to doing that.
One of my concerns with Amazon is they're going to be in an ability, when they get into the electronic health record medical game, is they are going to be able to break the current barrier between behavior, spending behavior, purchase behavior, with the electronic health record. And I think that's going to give them a huge competitive advantage when they come out with whatever they're going to come out with, unless because they have so much data on us, and they're going to be in the electronic health record game. So that's just one observation that I'm just waiting for Amazon to drop the bomb on how they're going to cross that barrier. They may give you an Amazon Prime discount, or something like that, the Amazon EHR record. But I think they want to combine your behavioral patterns with your electronic health record information. That would be my guess.
But that is an aspect of privacy that they may well find pushback against, because looking at it from the honesty perspective, people are costing on a lot more to the fact that people like Facebook, like Amazon, what they're doing is taking your information through the use of their system and going behind your back and doing stuff with it that's nefarious in some sense. And if people begin to get the sense that Amazon are tying their buying habits to their health data without it being open, without there being honesty about that, I think there will be pushback against that. So I think that's one flaw in that, is that suddenly it becomes personal when it's to do with your health data. It's all very well recommending me things that you're going to, push me into buying because you've done machine learning on it. But if you're suddenly pushing me into health decisions because I've bought certain products, I think people will begin to push back against that, as I say.
I think you hit on the nail on the head, though, with the trust, because, patients aren't that cautious or private about their medical records. Honestly, because I think the majority of patients have no idea all the EHRs and all the HIT vendors out there, including HIEs, all sell their information. An absurd amount, actually. Having worked for those companies, I know this for a fact. So it's crazy to me because most patients have no idea that that's even happening. That's why everyone was all of a sudden upset with Facebook that, hold on, my information was sold. Like, what did you think was happening in the background? It was amazing to me how many people were shocked about it. But if you're honest and open and upfront about it, I question, side note about the 23andMe, how upfront they were about the opt-in, opt-out. I will reserve my opinion on that. However, if you're more honest and upfront about it, I think patients, yeah, as you're saying, if you're honest about it, they're more willing to be a part of that. And back to Dr. Worrell's point, there's going to be a gold rush as soon as they find out that they can monetize that health record. There's just going to be a crazy amount of people rushing to that. So,
yeah.
Yeah.
And I think that idea of pooling data and selling that, I think that's also quite significant, because if I was to sell my health data, it's not very interesting. I'm not going to get more than pennies for it, to be honest. But if it's part of a 100,000 people, 200,000 people cohort study where that data is interlinked, suddenly the individual value of my data gets multiplied out. So I think, and that kind of thing that you can do with kind of hierarchical tokens, with kind of composable tokens, suddenly becomes very powerful. Yeah. If I can donate the query that accesses my data to a much wider query that accesses everyone else's, suddenly that becomes much more monetarily valuable than just selling my data by myself. And it also gives you that kind of unionization effect, in that you can bargain more once you're grouping data together. So I think, again, that's a very kind of powerful aspect to it.
Mm-hmm. Yeah,
absolutely.
I want to add to that as well. It's great that we can sell our data, but what's the next step? What's the secondary order of thinking there? Now pharmaceutical companies, they can just make more drugs to jack the price up higher and profit off us a little more. So it's not necessarily, we're not solving the overall problem of healthcare. I think the bigger, what is health? I think we have the bigger picture here is, now that we have a large population's data set of health here with genetics, biomics, their wearable data, all your health records, now we can use this to come up with personalized nutrition, just come up with personalized plans for specific demographics of the people that we have. So we can start incentivizing and start finding trends in this data that we do have. So internally, as far as the Citizen Health open source ecosystem, we can start using this data along with the organs on a chip, John. That video I shared the other day, that's next level stuff. Now we can start coming together to try to find cures for diseases. And this is kind of the bigger picture with what we have going on later. And once we do start generating a lot of savings, a lot of capital in this model, we can start having these hacker biohubs, if you will, where you can start bringing on researchers funded by Citizen Health, funded by the Medit token, and we can start doing research and development based on the data sets that we have. And we are talking about 5-10 years down the road, and we do have the capabilities to run massive tests on miniature versions of yourself. And just to throw that out there, I have to share this video. Have to. Everybody's familiar with organs on a chip, right?
Next level.
Organs on a chip. It's a microfluidic array. Basically, you just have small channels in there where blood flows. You can mimic an organ on a chip, a microchip. Well, this company is taking it a step further. And please just watch this video when you get a chance later about this. It's an organism on a chip. So you have basically all your organs on one microchip. And you can just imagine having thousands of these things, almost like a data center, but you have a bio center, and you're constantly running tests on different drugs. I mean, I'll think about all the drugs that are sitting there don't have the funding to get to the next leg of the the approval process or the testing process. You can't get off the bench. And here you can run that for, pennies and run all these tests and figure out which drugs do work, which drugs do not work, and cull the drugs that are going to kill you, and start personalizing medication down to the patient, the individual. So that's what I see the bigger opportunity here now that we do have the ability to aggregate and source all this data, is what we, the people, can do with it, not necessarily what the pharmaceutical companies can do with it.
Yeah, you almost have this kind of healthcare advocate that's out there doing research on your behalf, that's discovering things personal to you, that knows about you, that's kind of representation of your genome, your health record, your personal circumstances, and matches you up with the kind of the nodes in the network that are personal to you, and it becomes a kind of a pull rather than a push. That or push rather than pull. So it's kind of going out there into the system and looking for things that match you, that research that matches you, lifestyles that you want to do, techniques you might want to try, and then grouping with other people and doing that research on your behalf. It's a very, very powerful idea.
Mm-hmm. Sorry to get off on a tangent there, but I got excited when I saw that video. I had to share it.
Have you approached, so we talked about the consumer side, the patient side of things. In terms of the physician side of things or the provider side of things, have you thought through any engagement with malpractice insurance companies? For example, we want to get physicians within your ecosystem, okay, who want to be part of it and want to run their apps and that type of thing. Whereas one of the red flags, one of the daily things that physicians worry about, a pain point for them, is concern about malpractice. Do I have enough malpractice? It's nearly an irrational concern because usually you do, and usually bad things don't happen and you have enough malpractice. But if you could somehow, I know that Optum, which is part of United Health, is doing some stuff with blockchain to monitor providers' skill level. Okay, so they're trying to use blockchain to track providers from state to state, because I think they're going to use that for recruiting purposes and other things like that. But I'm curious, have you ever thought through any insurance models for physicians where somehow malpractice companies could access physician data, maybe about their health and their habits and other things, and physicians could get Medex credit for additional malpractice, like I have in my car. I have different insurance policies on my car. It's just something to just put in the back of mind. I don't have it all sorted out, but just as a physician, there are certain pain points that physicians have. HIPAA malpractice that are disproportionate, that disproportionately motivates them. And if you offer something in those areas, the ears perk up a lot. So I just throw that out there for a topic to think about one day.
Well, I will do that research. And that's something that I knew it was an area that needs to be tackled, because I may have mentioned it one time. I had 2 packs of note cards and wrote down every single touch point, everything in healthcare I can imagine, and malpractice insurance was on one of those note cards. So I knew eventually that was something that needs to be addressed. So yeah, it's continue the conversation with that, but I haven't done too much research into it. But I do know that just having in general, the lawsuits are not that high in relation to the amount spent in healthcare, but having the fear of being sued impacts just about every single thing done in healthcare.
Well, it actually affects their health. I think the suicide rate for physicians is double or triple the standard. And it's those type of concerns that probably feed into that. So it's also a health issue, I think, for physicians. So something to fool around with, and I'll think about that too myself a little bit.
Okay. Yeah, I'm starting to think more now, especially with this network of physicians with the direct primary care and specialty care. Maybe if you could, there's got to be malpractice insurance groups of physician funds, where it's like a co-op of physicians, right?
There are some like that.
Okay. So, yeah, I'll have to think through that, do some research before I even speak more on that. Okay. Interesting. All right, everyone. Well, does anybody else have anything to add? Any more questions or comments? I know we kind of went a long time today. This is always a good thing. It's better than not having anything to say. All right. Well, if no one else has anything to add, then I appreciate everybody's time today. And this will be up on YouTube in a day or two. And feel free to share it around. And then look forward to 2 weeks from now. And we are talking about our open source project. So that should be a good one, a very good one next. What's the date exactly? The 25th?
25th.
25th. Yeah. Talking about our new open source initiatives. It's going to be fun. So look forward to talking with that. Look forward to seeing everybody back then.
Good night, James.
Great.
Yeah.
Thanks, everybody.
See you guys.
We'll be in touch.
Thank you.
See y'all.
Bye-bye.